Hi everyone, my name is Nandita Kumar, and today I'll be presenting on the impact of comprehensive sexual health education on youth health outcomes. A little bit about me, I just graduated from high school from Carrollton, Texas. During the last few years of high school, I've been involved in educational equity work in my school district and in my state of Texas. I founded an organization called LISD Students for Educational Equity to make sustainable and inclusive changes from curriculum to culture in my school district. And through an organization called Texas Freedom Network, I work to improve health education in Texas public schools. I was also the president and co-founder of my school's Girl Up Club, through which I did a lot of work to end period poverty, from fundraising period products to help those who couldn't afford them, to advocating for free period products in my high school's bathrooms. I was also an intern at the CDC Museum's Public Health Academy, and I plan to major in public policy and public health with the ultimate goal of working in health policy, advocacy, and global health. So on to the issue. As reported in the 2021 World Health Organization's report on adolescent health, there are three critical issues affecting global youth health: adolescent pregnancy, STIs like HPV, HIV, AIDS, and more, and sexual assault. So here are a few statistics to put these issues into context before we dive into each of them. 15% of young women worldwide, which equates to about 12 million, give birth before the age of 18. In 2020, 1.75 million adolescents between the age of 10 and 19 were living with HIV worldwide. And 1 in 4 adolescent girls aged 15 to 19 have experienced physical and/or sexual violence from an intimate partner or husband. So why are these statistics important, and why is it critical to address them? Well, complications from pregnancy and childbirth are among the leading cause of death for girls aged 15 to 19 years globally. To add to that, 3.9 million abortions in this age group are unsafe, leading to an increased mortality and morbidity. And the US teen birth rate is substantially higher than other developed nations, which is important because we're going to look at a few data sets from the US. And adolescents who may want to avoid pregnancies may not be able to do so because of knowledge gaps and misconceptions about reproductive health and contraceptives. Here is a map from the UN showing the geographical distribution of adolescent birth rates from 2005 to 2010. And onto STIs. AIDS is the second most common cause of death among adolescents globally. In 2020, over half of reported cases of STIs in the US were among the 15 to 24-year age group. Young women aged 15 to 24 years are up to 8 times more likely than men to be HIV positive. So it's clear that in order to ramp up the efforts in the fight against AIDS and other STIs, we need to have a more concentrated focus on young people and adolescents. Last but not least, let's take a look at sexual assault. At least 120 million girls under the age of 20, which is roughly about 1 in 10, have been forced to engage in sex or perform other sexual acts. 82% of all sexual assault victims under 18 are female. And globally, violence against women disproportionately affects low and lower middle income countries and regions. And these figures are thought to be higher due to underreporting. So it's clear that this issue is not just one of health equity, but also one of gender equality and progress in the rights of women and girls, as women and girls carry a higher reproductive burden than men and boys. So why do we see these shocking statistics? Let's take a look at the US versus globally. In the US, schools aren't legally required to teach any sexual health education. And that resulted in only 50% of US teens receiving the standard of sex education set by the Healthy People 2030 goals. And globally, we can see these same exact issues play out with a lack of formal health education and a lack of testing resources. To add to that, it's taboo in many cultures across the world to discuss topics like reproductive and sexual health, especially among adolescents and young people. Now that we have a good understanding of what the problem is, let's take a look at an evidence-based solution: a comprehensive sexual health education curriculum that is medically accurate, inclusive, and continuous through childhood. So what does that look like? Like we just discussed, ACOG has defined 4 key components to be part of a successful comprehensive sexual health education: medically accurate, inclusive, consistent, and culturally competent. Let's take a deeper look at each one. A medically accurate curriculum consists of age-appropriate discussions of body parts, organs, consent, and decision-making. This enables youth to label body parts and recognize inappropriate behavior, aiding in lowering sexual assault rates. Education on reproductive functions and anatomy clearly establishes how a pregnancy occurs, dispels myths about sex, and explains STI transmission mechanisms, prevention, and treatment. This all has the impact of reducing stigma and increasing understanding of reproductive health, as well as empowering adolescents to take care of their reproductive and sexual health and not have shame about normal bodily functions and processes. The LGBTQ plus community faces disproportionately higher rates of sexually transmitted infections, sexual violence, and other health risks. And while many LGBTQ youth thrive during adolescence, stigma, discrimination, and other factors put them at an increased risk for negative health outcomes, highlighting the importance of an inclusive curriculum that addresses healthy sexual and non-sexual relationships, gender identity and sexual orientation, recognizing and preventing sexual violence, consent, and decision-making. And ACOG recommends that comprehensive sex ed begins early in childhood and continues through a person's lifespan. Some may wonder, why do kids need to learn about sex ed? Well, the key word here is age appropriate. Skills like exercising consent, creating and respecting boundaries, and taking care of your body need to start from a young age. And age appropriate discussions of consent, reproductive functions, and more can facilitate that. Furthermore, Columbia University study showed that sex ed before the age of 18 has a protective effect, reducing the risk of sexual assault, especially for young women. Last but not least, a successful comprehensive sex education is culturally competent and adapted to the community's culture, language, and beliefs. This can be best achieved if trusted community members are included in the creation and execution of the educational programs. It's important to include the community's values in any educational material in order to increase participation and engagement, foster respect and improved understanding, and overall reduce racial, ethnic, and socioeconomic disparities. And all successful sex education should include discussions of consent. Teaching consent is proven to assist in quicker interventions in childhood sexual assault. And like the education we just discussed, it should begin in early childhood and continue through a person's lifespan. Consent should be taught as a life skill, not just a sex skill, and we should remember that as we move forward. Effectiveness. What's the proof that taking these preventative measures works? Well, in comparison to adolescents who received abstinence-only sex ed, which was reported as ineffective in preventing teenage pregnancy, those who received comprehensive sex education were significantly less likely to become pregnant. And multiple studies done across the world showed similar levels of efficacy, showing us that comprehensive sex education does in fact work in improving youth health outcomes. So let's recap. Comprehensive sex education leads to a lower incidence of STIs, unintended pregnancies, and sexual violence, which overall society benefits from, with healthier adults mentally and physically, correlated with higher educational outcomes, reduce preventable deaths from pregnancy and STIs, and ultimately lower healthcare costs. Moving forward, how can we take action in our communities? You can help by becoming a peer health educator. Find a program in your city or reach out to your city or school board to start one. Explain them the importance of one and get involved. Advocate in your school. You can speak to your school board and school administration about improving and expanding the sex education curriculum. And last but not least, you can join your district school health advisory council. They often lack student representation, and it's a great way to get involved in the decision-making process. Lastly, wherever you're listening in from around the world, I encourage you to think about how we can use education and public health knowledge to transform communities across the globe. Here are my references, and here's a quote from the WHO. Adolescents need and have a right to comprehensive sexuality education, a curriculum-based process of teaching and learning about the cognitive, emotional, physical, and social aspects of sexuality. Thank you for listening. I want to thank my teachers, mentors, my family, and the Johns Hopkins University GHLC team for giving me this amazing opportunity to present about this important topic and allow me to get more involved in the field of global health. If you're interested in advocating for better sex ed or health education in your school, or want to find ways to get involved in your region, you can contact me with the email on screen. Thank you for listening.